welcome to this video. I'm Mgbenitezri, Ricardo, and we are talking with Miché Roberts from Johannesburg in Buenos Aires. And the idea of this video is to share the point of view of Argentina and South Africa about COVID-19 and how the lockdown, or the quarantine for me, has an impact in our social political life. We're trying to share this knowledge and trying to connect with you. And the idea of this, and of course the division of my place in Instagram and my other social net, which is Mgbenitezri, is try to close the continents, try to close the gap, to show the gap between Africa and Latin America, and try to know how are the same challenges and the same things we have to deal. So, Misha, thank you very much for your participation and for be here and trying to share your knowledge and your time, of course. Well, at first, we would like to talk about the current analysis about what's happening with South Africa and Argentina. Can you tell us how is lockdown and how is South Africa deal with COVID-19 until now? Okay, we already know that in South Africa and Argentina we have around 3,000 infected cases, and doesn't mean there is the total amount of people who has COVID-19. This is the total amount of people who has been already tested, and of course the numbers can be really tricky. That was a topic we want to talk. You can have more death rates that, for example, Argentina is higher than South Africa, but doesn't mean that Argentina could be a mixed comparison with South Africa or otherwise. For example, Algeria has less infected cases than South Africa and has 300% of death rates higher than South Africa, and of course from Argentina. So there are a lot of little details that number didn't tell us, but that is important. In the case of how we have to deal, South Africa and Argentina, we have the same kind of people that already know have COVID-19, around 3,000, correct?
Yes, that's correct.
Okay. And of course, the second topic we were talking is that our governments are trying to encouraging two kind of strategies. For one side is have this kind of lockdown measures that of course has a really negative impact on economy, but has a really positive impact in health, in social health. But at the other side, they have to gain some time in order to get some vaccines, we are waiting, or at least some aid economy or of international finance, in order to have more tested, in order to be more ready, in order to improve our health systems. Because if the infection rates is booming again, at least we'll be already best prepared to deal with it. That's correct, no?
Yeah, absolutely. And I think just to add to your point as well, in the case of South Africa, we're going into our winter season now. So one of the characteristics of this COVID-19 is that it thrives in colder climate and colder weather. And that's a problem for us because obviously we've got a higher risk of infection because of the winter. But another issue that is being caused now, and why social distancing and why government's policies are so important at this point, is because we don't have enough bed capacity. Our hospitals cannot give all potential cases of COVID-19 priority if we've got this high number of cases and we don't have enough bed space, and we still have other issues in the country. So you might still have issues where people need intensive care beds, such as car accidents or serious critical conditions. So the responses of government has been very responsible in staggering the amount of people who would essentially be needing government services. So as much as there is this economic impact and the social impact, I think that balance coming in between is how is government preparing their resources that they currently have. And like you say, South Africa at least, we've received international aid from the United States of America, from Europe, from a lot of wealthy nations through financial aid. But also there has been a lot of internal investment to alleviate the economic impact of COVID. But again, the issue is how is government going to use those resources and also the capacity that we have now needs to take into consideration the winter period that we're in, and it needs to take into consideration, how we're going to use these resources as responsibly and as strategically as possible.
That's great. Thank you, Mish. One question, in order to get some comparison. Here now is April, so we had the same kind of season, so we are starting our autumn. And of course, we are really care about the other kind of flu that we have to deal. And in this case, Argentina has started a campaign of vaccines against the other types or the kinds of flu. And I would like to ask if South Africa has the same kind of policy.
Come across anything like that. That's not necessarily that it's not happening. It's just maybe that's something I haven't picked up yet. But usually government often has drives to reduce the amount of people just infected by the normal flu during the winter period. So it's a general that, let's say, pharmacies and hospitals and clinics will start giving flu vaccines out for free during this period. So I'm not certain what their response is now given this outbreak, but usually we do have a pattern of providing vaccines against other kinds of flu.
Okay, that's great. So going to another kind of topics, can you tell us at first, maybe too many people in Argentina hasn't go to South Africa, so they didn't know how is Johannesburg, how is the neighborhoods, how is the places. So can you tell us how is your neighborhood, or maybe how is your income rate, if it's possible to tell us, and maybe which are the difference of the different kind of population, at least in Johannesburg, with people who lives in below poverty rates, people who is like a middle class, a low class, who has houses, who has not. They are all together, they live in buildings, they live in houses. So can you tell us a little bit about it?
Yeah, for sure. So South Africa has got one of the most unequal societies in the world. So we've got a very, very, very rich population of people, and then we've got very, very poor population of people. And what that essentially means is that in your poorer communities, I can name a couple of areas such as Alexandra, Khayelitsha in the Western Cape. It's highly dense. It's a highly populated places. So you can't necessarily practice what social distancing is, because you've got one shack so close to the other shack. People are unemployed, people are struggling to make ends meet. There's a higher dependency on government social grants in poorer communities. And what that often means is that people have to integrate. Unfortunately, they have to integrate to get social grants from government. They have to go out, nurses have to leave, the taxis are still operating. So it's been an issue of how to contain lockdown regulations in the poorer communities, whereas in the more rich communities, that isn't an issue. So people have resources, they don't need to go anywhere. And what we've seen, and maybe in the past 2 or 3 weeks, is that there have been coronavirus cases in the townships, which is a very big problem for us because it is closely dense, closely populated place. And, we know the nature of this virus is that it's unseen. You're only showing symptoms 14 to 21 days after you've been in contact. And in a highly populated community, that's a very big problem because it can spread very, very easily. And just on that point as well, I should also bring, police legitimacy, police accountability with us in this conversation, because you have a lot of instances where police are being investigated for murder, they're being investigated for abuse of human rights in the poorer communities. And now what that is also doing is it's magnifying our social issues. So as you might know, that South Africa we've had a history of apartheid and racism. And what you start having now is people saying that police are targeting Black people while they're letting white people in their communities break lockdown regulations, do what they want. And it's creating a serious issue for trust in our communities, especially like where rich and poor communities are very close to each other.
Yeah. Well, that's a really interesting topic that you add. In fact, for your followers, 1 week ago, at the first week of the lockdown in South Africa, I made a kind of visual how about Twitter with a hashtag lockdown SA, and we're trying to follow what people were talking about, were kind of the similar topics, and what kind of things they were publishing. And one of the things that Misha is telling us now is just like that. The idea that security forces were focused on Black people or poorest people, and maybe what people were have to be detaining, they were more polite or more tidy, is something that made too much anger and ignite some, or ancient grievance in that kind of society. And in my opinion, Michelle, you will correct myself, but I guess it's not too difficult in South Africa to ignite the violence on people, right?
So yeah, no, I definitely think it doesn't take a lot for us to have this issue of race in the country. Unfortunately, I think, in terms of policy, government has tried to bridge this gap, but it hasn't necessarily taken effect in the daily lives of people. So people are still very traumatized by what happened in apartheid. Also remembering that apartheid wasn't that long ago. It was about how many, 2-3 decades ago. Yeah. And that's one generation. And unfortunately, it takes a lot longer to kind of get real social cohesion than 3 decades. So we have to be aware of that. And I think instead of pretending like it doesn't exist, we should possibly just acknowledge it and acknowledge that there's still a lot of hurt in this country. And also remembering that the police were a very vital force in the apartheid government, and them exerting this kind of force and killing people during this period is reminding a lot of people in poorer communities of the legacy of apartheid. So it is a very sensitive topic.
But police forces has not to be depurated, I will say, after apartheid. I mean, maybe in the apartheid government you have more, white population in security police, and now with the black empowerment policies of the ANC in 3 decades, I suppose the police force it wouldn't be the same kind of institution. So people still connect police with apartheid still, despite the human beings that are compound that security force.
Yeah, so I think this touches on another issue, which is police training. There's been a lot of social issues, in the past. So if I'm to talk about protests, behavior, let's say Fees Must Fall from 2016, just normal service delivery protests, police aren't necessarily training to deal with this kind of public disorder. And I think as much as the bodies have changed, the color of people have changed, unfortunately, the institution is still the same. So it takes a lot longer for an institution to change compared to how quickly one person can move and down. So I think that's also something to consider. Okay, yeah. So I would like to also speak about one other topic, which is, earlier on I was mentioning about the population in our prisons. And I read an article today where about 40 prison staff, as well as what do you call them? Inmates. They've tested positive for the coronavirus, which is a huge problem for us because the capacity of our prisons already in South Africa is overcapacitated. We've got way too many people in one prison cell, which obviously raises a risk for the spread of this virus. They can't necessarily practice social distancing policies as the government has required them to. So this is a very, very big problem. Also, the prison inmates, they've started wanting to protest. They want to be released earlier or to have certain conditions set for them to obviously escape from this new possible epicenter by people whose parole is almost up, maybe for them to leave earlier, or for people who are about to leave the prison system for them to leave earlier, just to make certain that the spread of the virus is not as bad.
Oh, okay, interesting. Well, So here about the prisons, I don't have I don't be sure how is the population, but of course it's a trouble indeed. And what's happening here is the government take a lot of policies at first in order to take measures about the inmates population. And one interesting of that were that people who were close to end their sentences, and they were as a risk population, they were able to go out of their homes, of course with like a house arrest. And of course there were some cases with in the case of women who were pregnancy or they were had with kids, they of course were able to go outside, of course. And another kind of case interesting here is that we had changed our government really early now. And in this change, we have the opposition now is the official government. So in the former government, there were some cases of people who were arrested by corruption case, corruption charge. And now they beg, also they ask for to the judicial to the justice in order to go out because they were a kind of rich population. They are hypertense, they are stressed people, of course, so they are politicians, but they trying to move and go out. In fact, the former vice president who were in charge, he's in her house now, and that was a case who takes some, how is the word? Sorry, some noise at the social media because they will say, okay, the change has government. Now you have your friends at the government, and now you are trying to release at the first time because you have the COVID. But I guess in some cases we can follow. They were able to go out, but maybe in other cases no. And South Africa has the same, if I'm correct. So you have a change of government, and the former government has a lot of charges of corruption, and maybe too many functionaries could be in prison or not. Can you maybe in South Africa happen something like that or not?
So nothing has happened like that in South Africa for the simple reason that, unfortunately, a lot of the people who have committed corruption in the country, or there are allegations of corruption, they haven't been put in prison in the first place. So,
okay.
They
were out.
It's difficult to take them out. But it does bring me to a very important point that I would like to make. I'm not sure if you're the people who will be watching know about state capture and corruption that has happened in the country. But for the past, let's say, 10 years, from 2009 up until 2018, we have gone through the worst period of state corruption that the history of our democracy has seen. And it cost our economy about 1.5 trillion rand, which is about $100 billion US dollars. And you can imagine, I get very emotional thinking about how could that $100 billion help us right now when we really need that money. We've our national airline carrier, who's been under business rescue for the past year, they're about to retrench 4,700 workers because they can't afford to pay salaries anymore. And all of these things stem down to corruption. So unfortunately, it's a real pity that we haven't seen any real prosecution of people who've caused this corruption in the country. And even if they were put in prison, I would be the first one to say, keep them in prison, don't let them come out early. But yeah, unfortunately, our justice system still needs to recover from all of the state capture. Our justice system, or not the justice system, but the law enforcement. So our police and our National Prosecuting Authority, which is obviously the center of law enforcement in any country, they were a part of the corruption project. And because they were a part of the corruption project, it's taking a little bit more time to get the prosecution of these corrupt people. So yeah, that's where we sit now with corruption in the country.
Okay. Well, Mish, I guess we can move for our four topics despite the obstacles. We talk about South Africa and Argentina has the same kinds of people tested. We are dealing with the same with the same trouble. Of course, maybe our death rates are different, but our incomes and the issue to deal with people who live in the poverty rates when you have some townships or villas, as we call it here, really near to, with a lot of people living together, that makes a difficult to social distance and to measures to measures for clean yourself and has social healthy. You talk about your healthy system. You are is a little bit overcrowded. Um, Even you need some financials in order to improve it. Argentina maybe is not the big trouble. So here we have a really good public system. Of course, in the former government, the budget of the health system were decreased, but it still has a long history of state investment in public health. It's one of our best policies and values indeed, uh, healthy and education. So we are really good on that. And even that the private sector and the public sector is starting to be cooperative with the government, and at the end, that plus the lockdown measures we already take it, that could make the infection rates really lower comparison with the other countries in our region. So in my opinion, we are really good. We are doing well. But of course, we're talking about violence, and that topic is something that I would like to add. Here in Argentina, the rate of domestic violence has been higher now. In fact, in the case of children, they are a vulnerable population. Domestic violence, sexual abuse, grooming, or even another kind of crime like data banking, because too many people have to buy by internet. There are some insecurity issues that came with the lockdown. Of course, the social violence you talk is more public. You talk about the grievance, the apartheid. You talk about how people, despite 3 decades after apartheid, still watch the police force as a kind of threat, you could say. And that difficult the measures of the people have to have obedience to the security force, and that makes them difficult also. And of course, we go to the political current situation, and we talk about corruption, and we talk about how money is spent in things that now it will be really necessary. Argentina is facing a huge debt crisis now. And of course, our president said, okay, first the people, later the economy. We will know how we will pay, but we will pay maybe later, not sooner, but we do. Now we have to deal with this. And of course, lockdown has been a really negative economy policy, but necessary, and I guess no one is scared about it. But yeah, our two countries have to face COVID with a really budget deficiency that has been making more vulnerable now. That's correct.
Mm. Absolutely, 100%. So just before the coronavirus hit the country, we actually slipped into a recession. So when you speak about debt crisis, South Africa, we've been on the brink of a slowing economy for a couple of years now already, and it has been very difficult, to be dealing with the corruption issues on the one side and demanding accountability on that side, and also people first, economy later has also been our position. But I do have a sense that more and more we're trying to figure out ways to stimulate the economy again. So government has taken on a policy to put more money in the hands of people, and that is through increasing our social grants. There's a very big portion of South Africans depend on government grants and substitutes and subsidies to make a living. So to increase the social grant, to to encourage people who can work from home to still work, so that the economic effect of this virus is going to be devastating. And, you know, as you say, when it comes to making repayments on debt, that is something that we're going to have to consider after the fact, that people need to be safe first. Because I've seen on social media, people are saying it's no point in having an economy if there's nobody to work in the economy. So you'd rather have people alive.
You will have an economy of cats later. All pets working for the country, but yeah.
So yeah, for me, I think this is an opportunity, as difficult as it is for the country, for South Africa especially, and for the ANC maybe as well. It is an opportunity for governance to come right, and for governance issues at a political level, for people to start thinking about, you know, what does ethical leadership mean? What does it mean to have the economy in mind when you're making decisions, and to have society in mind? Because all of the issues that we're experiencing in the country is very, you know, we can speak about it as Argentina and South Africa, but I think as South Africa, it's just highlighting how many terrible issues that we have in the country that is due to bad economic choices, bad political choices. So the rise in unemployment, you know, America is apparently expecting an unemployment rate of 30%. South Africa, we already have 29% unemployment. So you can imagine what will happen after the lockdown lifts. So yeah, anyways, we've got poverty, we've got protests, we've got racial inequality, we've got economic inequality. There's a lot of issues that government needs to start focusing on. And if they don't take this opportunity now to shift the way they think about politics, I'm not sure what is going to change their minds.
Okay, completely agree with you. Again, in order to close so this talking, and another kind of enlightenment that they already had about what you're talking, we can make a good triangulation about Argentina, South Africa, and United States. You know, we have this kind of deal between economy and society, and I will say that if you want to have a good and healthy society, you need a strong and good economy. And that doesn't mean growth, that means develop, that means low poverty, that means care about people, be happy, get what they need, work what they have, and live what they can't. But of course, if you want to put in the other side, yes, like Trump likes or Bolsonaro likes, or maybe another country in Africa wants, you can have an economy of without any persons or any people. If you have all your people sick, they want to work. They can work. So doesn't matter, have a good economy without people, because economy moves by human beings. So if you want a good economy, have a good health society, and you have a health society, have a good economy. So I guess any way the side you want to see it, the two variables has to be together and close. And I guess this is the good experience maybe COVID has allowed us, has given us. And one thing you said was quite interesting. Today, this morning, I was watching our news media, and they were talking about, okay, this is an opportunity, an economic opportunity to Argentina. We were 3 decades of mistakes with economic policy mistakes. So this will be an opportunity to start to move well, because all the table chess has moved out. So maybe it's an opportunity. And you say the same. So as I tried to point at the first, South Africa, Argentina, we are in the same field. We have to sign the deal, and we have the same challenges and maybe the promising future that we want. So thank you very much, Mish, for your time, for your patience, and for all the tries that we're trying to make this. I hope all of you in South Africa, of course, that you're following Mish, and in Argentina and other parts of the world, because we have people from Italy, from Spain, from UK, even from Brazil, who are following us by Twitter and Instagram and other social nets. The idea is to try to share this to close continents, as I call you in the hashtag acercando continentes in Spanish. The idea is to know each other, to face each other, the same challenges, and try to shore the distance between us. So thank you again, Mish, for your time. I hope we can do it in another kind of occasion. And of course,
sorry, thank you so much. Thank you so much for the opportunity. You know, we've tried many times. I think we'll perfect it over time. But yeah, thank you so much. I think it's important that we do have conversations like this, you know, to bring continents together.
Okay. Well, thank you again, all of you. Of course, this video will be added to YouTube. Of course, Misha, I will send you a link to you. And of course, it will be in the social nets of Mgbenitezri. And of course, in Instagram, we will add it to the bio in order you can see it wherever you time. The best of this is that the Alive only has a duration of 24 hours. Now will be for eternity if we want. So, my dear colleague, I send you a hug in the distance, and of course, be safe, okay?
Thank you so much.
Bye.
Bye.